experience and his level of dedication to protecting the rights and improving the quality of life for the people in New Mexico, in the United States, and even around the world. So without further ado, please join me in welcoming our Governor, Dr. Richardson.
Thank you for being here today. There's so many dignitaries that I'm going to unfortunately skip a few, but I want to especially welcome the First Lady of Mexico, Licenciada Margarita Zavala, Dr. José Córdoba, who has worked very well with all of our border states, Governor Garcia, a dynamic new governor from the state of Zacatecas, Carmen Espino, Julia Bryan, so many of you here that are so distinguished. We're honored to be the host of this conference, the 9th Annual Binational Health Policy Forum, and I officially welcome you all. Bienvenidos. I want to thank the Pueblo of Milwaukee for being our hosts. As you can see, this is a beautiful facility, beautiful artistry, and in New Mexico we have our multicultural Hispanic, our Anglo, African American, Asian, and our Native American culture. And I would ask us to give a big hand to our Native American culture. Here in New Mexico, we have a long history of working with our international partners to ensure the health of immigrants and migrant workers call our state home. 40% of our population, in fact 43%, is Hispanic. This is the largest percentage of any state in the United States. Not only do we share a border with Mexico, but as I said, 43% of our New Mexico population is of Hispanic heritage, and 20% of New Mexico residents identify themselves with the mother country of Mexico. In New Mexico border counties, Spanish is spoken in half of the homes. We've established many partnerships and programs that address the health of our Latin American community. I especially want to commend our own Department of Health, Dr. Miguel, Sam Howell, so many of our leaders here that have made this international relationship so strong. In New Mexico, immigrants and migrants receive a host of health services through a network of safety net providers that includes 55 public health offices, 160 community health centers, and numerous providers in rural areas. The Department of Health's Women, Infants, and Children's Program supports women and their children during pregnancy and early childhood, while low-income residents have many options for accessing prenatal care and children's medical services. The New Mexico Department of Health and the Chihuahua State Health Services established the Border Influenza Surveillance Network, which was instrumental in serving as an early warning and response system during the first phase of the H1N1 pandemic. And I especially want to thank Secretary Córdoba for his help in working with us in so many border health projects that were vital to our communities. The surveillance network we established is now being used as a model for expansion across the entire U.S.-Mexico border region. The Department of Health's Office of Border Health is working once again with the Chihuahua State Health Services on a new project to control and cure tuberculosis patients in the rural areas of the Binational border region with the Nuevo Casas Grandes health jurisdiction. And just last month, we signed agreement with the state of Sonora to create the New Mexico Sonora Commission, which will focus on strengthening the collaboration between our states on many issues, especially in the health area, which affect residents on both sides of the border. We've also established the Office of Community Health Workers. Community health workers, or promotoras, as they are known in the community, provide health information to our immigrant and migrant populations who are integral in ensuring the health of the community. We're working to formally incorporate promotora model into the state health system and improved health education and continuity to care to tens of thousands of migrant and immigrant families. Last night in Santa Fe, with the First Lady of Mexico and Secretary Gordon, we celebrated the establishment of the second Ventanilla de Salud, which helps the Hispanic community increase their knowledge and use of health services and improve the overall health. And especially our thanks to the Mexican consulate for establishing these ventanillas throughout the United States. The first Ventanilla de Salud was launched in 2003 at the Mexican consulate in Albuquerque and has already helped more than 3,000 people. Tomorrow, our Office of Border Health will premiere a new movie in Las Cruces, New Mexico, called I Wish I Would Have Known, that chronicles a Hispanic family's challenges in dealing with obesity and diabetes. This film will be distributed throughout the 6 Mexican and 4 U.S. border states. So as you can see by these many endeavors, we're committed to finding new ways to help our immigrant and Hispanic residents and to ensure that they have the necessary health resources available to them. This is why the work of this forum is so important. I especially want to commend our border health initiatives that have come forth from the border governments, the states of California, the states of Arizona, Texas, and New Mexico, working together with the 8 Mexican border members that are represented by outstanding governments. So I have now reached the best part of my speech. It's Pete, the end. Thank you and welcome.
Thank you so much, Governor. Now I would